So good evening guys, if I'm visible and audible, give me a thumbs up, all of you. Just waiting for your messages. Yeah, so Dr. Rajat. Yeah, good to see. So let me start the session straight away. Let's wait for some time for people to join in so that we can have the MCQ discussion properly. Okay, so once people are there, it will be much more better. Dr. Salman is also there. Good. So I think all the old people have also joined again. Nice to see. Dr. Rajat, Dr. Salman. बाकी के लोग. So I'm just wait. We'll just wait for a minute. Yes, so we see Dr. Saif also. Nice. Good to see. Right, guys. So just I'll take a minute to introduce things and then we'll start the session the way we finished off before. Okay, so we'll start the same way. My name is Dr. Vinish Srivastava, presently the head of the department, Associate Director of Anesthesia and Critical Care. I'm working with the Fortis Lafam Hospital in New Delhi. Welcome, Dr. Sadaf. Thank you, Dr. Sadaf. Let's start the session now. Just give me 2 minutes to introduce things out for the new people, which gets recorded as well, and then we'll start with the session. Right. So before becoming the head of the department, I was working here at Fortis Lafam Hospital in New Delhi itself. I worked as a senior consultant for the last 8 years. Prior to that, I was at Maulana Azad Medical College. I've done my senior residency from there. I was also a specialist over there, sort of assistant professor. Before that, I was at Deen Dayal Upadhyay Government Hospital, New Delhi. I've done my DNV secondary from there. Prior to that, I was at Grant Medical College and JJ Hospital, Mumbai. I've done my DA and FCPS from Grant Medical College, Mumbai. Before that, I was at Lokmanya Tilak Municipal Medical College, Sion Hospital, Mumbai. I've done my respiratory medicine from there. Prior to that, I've done my postgraduate diploma in hospital and healthcare management, Symbiosis, Pune. Before that, MBBS. That was a slight introduction about myself. And as always, I always say, apart from clinical duties and studies, I have some hobby. For me, is playing the guitar. Here I'm playing on the stage, local folk band. Also teaching students, preparing for all these postgraduate medical entrance exams and FMGE exams for the last 10 years now. Now I'm associated with Unacademy. Okay, so people who haven't followed me up, do follow. Thank you for all the dedications, guys. As I said, this is on the YouTube. So people who haven't downloaded the app, please download it. You need a code to enter inside. You can use any code that you have, any educator code. Important. There are 3 things that you get once you open the app. There's a plus course, free course and special class. Plus course is the subscription based one which is there. This is for people who are preparing long term. Correct? Special classes here on the app are the free classes which you see. This is where we hold all the MCQ sessions. People who are prepared and just want to test their knowledge can just come through the special class, which are the free ones. Okay. Subscription, as I said, is for people preparing long term. Remember that point. Okay. So special class has the same thing. You know, these are those free classes which I was telling you. Complete interactive, just like this. Polls are there. You have a raise a hand feature. Never miss a class. You get to know when it is held. Lecture notes are there. Anywhere, anytime you attend it. Okay. Of course, the plus is the one which is a subscription based. Okay. This is where you get both live and recorded happening. All right. Tests and quizzes. You study on the device of your choice, and there's access to the question bank which we have. It's a wonderful question bank. Also, Iconic subscription is something which has both Unacademy and Prep Ladder going together. Okay. It's like kind of best of both the worlds. Okay. Now, as I said, Plus and Iconic is where you complete the complete courses. This is very long term, you know, where you're trying to finish off the complete course of anesthesia or whichever subject is around. Of course, it also helps you get the question bank, which has more than 25,000 questions and got complete explanations based on that. Okay, the questions which are there. So based on what kind of goals that you're looking for, if you're looking for a long-term preparation, you either go for Plus or Iconic subscriptions, or otherwise the special class is good enough for the people already prepared. These are all the people who did pretty well in the NEET PG 2021 exams. A new feature, I think all of you are aware of that on the app, which is available as Raise the Hand. Please mark your times and dates. These are the tests which keep on happening. All right. So this was about, you know, Wednesdays, Fridays, Saturday and Sunday. This was about the free tests which were being held. Similarly, we'll have in the month of Jan also. We'll let you know about it. And these are the tests for the plus batches. So remember, these are all MCQs that we hold. And then we have a discussion based on that. Okay. So both the special and the plus. So take part in them. It makes you understand where you stand. All right. New batches that are coming up. If I don't tell you, how will you come to know? So, or any one of us, if we don't tell you, how will you come to know? So we have the FMG 2022 and NEET PG 2022 MCQ discussion batch coming up. Okay, and these are the new things which are available: 24 plus 4, 12 plus 2, and 6 plus 1. Okay, so these are different things which are already there running on the platform. Right, so people who haven't followed me up, do follow me up. Remember, as I said, following up, this is something which I got from in the Telegram. I shared my Telegram ID with all of you, but a lot of people send us, so are you on plus? I'm not a student. I will help you in completing your target of subscriptions. Can you see my answer? And I want this to tell everyone. We have no targets. We teach because we enjoy teaching and because the students take anesthesia as a subject of choice. The aim is never subscriptions, and there is no target given to us ever. Trust me. Okay, that's why we say special are the free ones. So people who are well prepared can go for them, which are the complete free classes. Okay, it's only long term that you need to prepare. Right? And this is why we wait for, this is why we teach. This is exactly why we teach. Amazing mark score, and you get messages like this, it makes our day complete. Just now FMG exam has taken place, and I'll share some of the things from the FMG exam. Can you see this? So first attempt FMG clear with a score of 165, 186. And this is what makes us to teach again and again, again and again. This is exactly, why we teach. This is the reason we teach. It is not for followers. It is not for targets. It is not for subscription. This is what makes our day. This is why we teach. Okay, guys? So just keep in mind, for all the people who spread wrong information, throw it away. That's my Telegram ID. Please note it down. Any questions and doubts you can ask me. I'll try to solve them to the best of my ability. Okay, so let's start. And we were starting on one question to which Dr. Salman had given an answer. So we'll start from there. Okay, we'll start with the same question. And there are any doubts, guys, you can ask me at my Telegram ID. Okay. So let's go ahead and start where Dr. Salman was giving the answer. So this was the question that we had. Okay. So our question was, critically ill patient is being taken for MRI. We will need oxygen during the MRI. This cylinder is made up of what? Yes, guys. A is polyvinyl chloride, B is molybdenum steel, C is iron, and D is aluminium. Dr. Ankita, Dr. Salman, other people? Mark your answers, there are so many of you. Mark your answers, guys. Dr. Ajat, Dr. Saif, Dr. Sushma. Okay, so confusions between only two places as I can see. All right. Where do I keep my mobile? I'm trying to find a place. Just give me a second so that I can keep and see your messages properly. So I'm trying to keep the message in such a manner that I can see your texts clearly. Now I can. Okay, so there we go. So Dr. Selvi, nice. So I think most of you are given two options, all right, and that is between B and D. Okay, so molybdenum steel and aluminium. So most of you have marked molybdenum steel. Remember, the cylinders are made up of molybdenum steel, but when you carry cylinders made up of molybdenum steel in a MRI room, there's a magnetic field and the cylinders can get attracted to it. Okay, so if there's a patient going in for MRI and this patient needs oxygen, a normal oxygen cylinder, a normal cylinder are the ones which are all made up of molybdenum steel. All right, so these are molybdenum steel cylinders. Problem is when you take into the MRI room, there's a magnetic field, it can get attracted. So as Dr. Saif has said, Dr. TS, Dr. Selvi, Dr. Sushma, all right, so all these, and Dr. Salman has mentioned before, you cannot carry a molybdenum steel cylinder in an MRI room. You have to have special cylinders. So the special cylinders which are going for MRI room, guys, are made up of, ideally in the past they were made up of aluminium in the past, and nowadays they are made up of titanium. Okay, so for exam, remember, when a patient is going for MRI, all right, then the correct answer becomes aluminium and titanium. These are the two things, aluminium and titanium. All right, so one is aluminium, other is titanium. Thumbs up, guys. Is that okay? Routinely all the cylinders are made up of molybdenum steel. Okay, sorry. All right, all the cylinders are made up of molybdenum steel, but for MRI, they are of aluminum and titanium. The other two options which were given to you, they were just time pass. So polyvinyl chloride is normally PVC, plastic, useless, leave it out. Iron is not there. Also, another question that comes in exam is which is the most common size of cylinders used. Okay, so cylinders basically come in various sizes from A to H. Some people say J, but just remember normally A to H. But the most common use is size E. Okay, size E. So I got a thumbs up from all of you. Let's go forward and see the next question. Okay, so we've discussed till here. Next one. Identify neuromuscular monitor, electrocardiogram, electromyogram, bispectral index. Yes, guys. Dr. Ankita, Dr. Saif, that was size E which we were discussing. The next question now. Okay. Last 2-3 years, the reason that we discuss this often is, the repeated questions, they keep on getting repeated in a different manner, right? So all of you are absolutely correct. What you see here in front of you is D, bispectral index, and I always emphasize this point. In fact, if you go through my old YouTube videos, if my videos which are getting recorded, you will see in most of the videos, every time I have asked about this Mallampatti classification, which I have asked even right now. And even this time, Mallampatti classification was there even for FMG. So remember, these are those questions where people concentrate on, which you should be aware, which are difficult ones. So many times what happens is you will not be able to identify unless and until you keep on repeating them again and again. And that's exactly why we keep these images and questions on Mallampatti, questions on cylinders again and again, so that the idea, it gets reinforced into your mind when you're attending the class. Okay. Of course, I know most of you would be knowing it, but in case you should not be forgetting, remember this is what is called as the bispectral index. It is not a neuromuscular monitor. It is not ECG, which all of you know. It's not even electromyogram, which is called as EMG. Okay, this is what is called as a bispectral index. As you can see, it is attached, electrodes attached to the brain. Basically, bispectral index itself is based on EEG, electroencephalogram. Okay, so what it does is bispectral index basically tells you the depth of anesthesia. Okay, it tells you the depth of anesthesia. It's called a depth of anesthesia monitor. How deep is the patient under anesthesia? Means whether he's sleeping or he's awake. How do you understand? If the patient is awake, you get a reading of 100. If the patient is deep under sleep and coma, that is 0. That is coma. A reading of 100 means the patient is awake. A reading of 0 means the patient is in sort of coma or dead. You see the whole spectrum between 0 to 100. So if a patient is under GA and surgery is going on, I want the value, I want the value to be between 45 to 65. This is for general anesthesia. And if there is sedation, I want the value to be between 65 to 85. Okay. Dr. Ankita says 40 to 60. Yes, sort of, absolutely correct. Okay. So 45 to 65 is set for GA, 65 to 85 is set for sedation. So now imagine if this patient, we have attached the electrodes on the brain and the forehead, and you get a reading. Now surgery is going on, you get a reading of 90. It means our patient is near awake. So you have to increase the dose of anesthesia so that he remains unconscious. He's sleeping then. He becomes unconscious further. You're going to further put him into the more deeper into anesthesia. Okay. Now, if you find the reading going towards 20, which means the patient is going towards coma, so you will decrease the anesthesia, and therefore this becomes easy to titrate when you're using the inhalational agents, and that is why inhalational agents are so often used for maintenance of anesthesia. So either you can increase the depth of anesthesia, or you can decrease the depth of anesthesia or increase depending as to the inhalational agent that you're giving. That is why you find basically IV drugs are used as the induction agents of choice to put someone to sleep. And when you want to maintain the patient to be into sleep, you use the inhalational agents. Okay, you can titrate them much more easily comparatively. IV agent once inside is already inside. Inhalational agents can be titrated much better. Okay, So that is what is called as the depth of anesthesia. How deep is the patient under anesthesia? So if you get a reading of 45 to 65 is said to be for GA, 65 to 85 is said for sedation, and this is all based on EEG or electroencephalogram. Thumbs up everyone. Clear? Clear. Okay. So this is what is called as next. ये क्या है फिर? What is this then? Okay, so I got a thumbs up from all of you. And which is the next one then, guys? ये क्या है? Okay, so Dr. Ankita says, Dr. Saif, radial artery. नहीं है क्या फिर? Correct, Dr. Saif and Dr. EMG. EMG nahi. So Dr. Salman, it is not EMG. Dr. Selvi, it's not EMG. This is what is neuromuscular monitor. So what you are doing is exactly why this question has come. Same thing. Correct. What you are doing is I am monitoring the neuromuscular junction. Do you remember I was discussing with you succinylcholine and I was discussing with you vecuronium previously, which is depolarizing and non-depolarizing muscle relaxant. So therefore, these drugs are the ones working at the neuromuscular junction. Okay. So what is doing is, in case you want to monitor, how the drugs are working, whether the muscles are still paralyzed or not, this is where we use something called as the neuromuscular monitor. So what does the neuromuscular monitor do? It monitors the neuromuscular junction. So therefore, the nerve which is more commonly used is the ulnar nerve. All of you have mentioned it correctly. And corresponding to that, you will see the response in the adductor pollicis muscle. Okay. So this is our neuromuscular monitor. It tells you basically about the muscle paralysis. It helps you differentiate between the depolarizing and non-depolarizing. All of you would be knowing, there's a diagram which comes like this: 1, 2, 3, and 4. This is the normal stimulus which is given, train of 4 mode. So if you give another same response comes, this is the normal response. If you've given a non-depolarizing, you get 1, 2, 3, and 4. You get fade. Okay. In succinylcholine, you get 1, 2, 3, and 4. This is with depolarizing. But the same fade is also seen in succinylcholine phase 2. So fade is seen with non-depolarizing and it is seen in succinylcholine phase 2. And here is seen succinylcholine phase 1. Okay. So this is normally a decrease in amplitude which you see. So this is our neuromuscular monitor. Train of 4 is the most common mode used here. Okay. And the most common nerve used is the ulnar nerve. Corresponding, the most common muscle is the adductor pollicis muscle. So therefore you have this neuromuscular monitor. This is the monitor. ठीक है? Dr. Salman, ये explain करने को मेरे को 2 घंटा लगता है. Almost it takes an hour and a half to explain this whole chart. Right now, all you need to remember is that the normal response is the same thing as what the stimulus that you give. Okay? And in case you get fade, it is telling you about non-depolarizing and succinylcholine phase 2. If you're getting a decrease in amplitude, it is succinylcholine phase 1. So if you have to discuss this whole concept behind it, guys, it takes almost about an hour and a half, 1.5 hours. Okay. We don't have that much time to discuss this out. Okay. Dr. Salman would have loved to do that. But in short, for exam purposes, just remember when you're discussing as MCQs, you just need to remember that this is the normal stimulus that you give. This is a normal response if there's no muscle block. This is what you see if there is non-depolarizing or succinylcholine phase 2. And when there is succinylcholine phase 1, this is what is the response. Okay. So as of now for MCQ discussions, I think this is sufficient. But otherwise it takes a lot of time. Okay. It's no point me trying to tell you half and trying to finish it off early when you don't even understand. So for the time being, I think this is good enough. Right. So next one. This almost looks like a neuromuscular monitor, but it is not. This is basically what is called as a nerve stimulator. Do not get confused between them. This has never been asked in exam, but I'm just telling you. Okay, this has never been asked. Of course, neuromuscular monitor has been asked. Bispectral index has been asked. Can you see there's a needle attached here? So this needle has got some centimeter markings. It is going to tell you how far you are entering inside the skin. This nerve stimulator is used to give blocks to the patient. You must have heard that anesthesia people give various blocks. There must have been brachial plexus block that we give. Okay, there is sciatic block which is given. So how do you give a block to various nerves which are placed inside the body? So one of the ways of doing that is using the nerve stimulator. So remember, there's a difference between a neuromuscular monitor and what you see is a nerve stimulator. This stimulates the nerve so that you know you are near the nerve, and then you can inject the drug from there. In fact, you must be knowing there's something called as tap block, which is there. There is celiac plexus block. Of course, I'm not using this for a celiac plexus block, but I'm just saying wherever there is a nerve in the body, you want to block it, you can use this, which is called as the nerve stimulator. Okay, this is neuromuscular monitor. ECG everyone knows. This is what is called as EMG. In fact, to monitor the neuromuscular junction, the best thing is not the neuromuscular monitor. Dr. Salman had given this answer before. He had mentioned EMG point. Ideally, to monitor that neuromuscular junction, the best thing is the electromyogram, EMG. That's an MCQ question. So, neuromuscular junction monitor करने के लिए, the best thing is not neuromuscular monitor. This is what is used clinically. It is easily available. But the best thing to monitor a neuromuscular junction is this device, which is called electromyogram, which you people must have seen in physiology. Okay, thumbs up everyone. Is it clear? So for neuromuscular junction, the best thing is EMG and not neuromuscular monitor. Clinically, yes, we are using this, but ideally, this is what is supposed to be the gold standard, the best thing to monitor neuromuscular junction. Are thumbs up everyone? Is it clear? All of you? Okay. इसका value कितना है? You have an electrode attached to the brain. This is bispectral index, depth of anesthesia monitor. So if I have to ask you a reading for this patient, how much is the reading of this patient? What would be the reading? So you have to gauge between 0 to 100, na? Yes, Dr. Saif, absolutely correct. So this patient is awake. Okay, he's not under anesthesia. So Dr. Saif has said correctly, he is 100. The patient is awake. Clear? Okay, I think all of you have done it. Nahi, 45 to 65 nahi hoga, Dr. Selvi. The patient is awake. Do you see this? I asked you in this patient what would be the reading. I attached this. So the reading is going to be 100 because our patient is awake. Clear everyone? Of course, they won't ask you the reading in exam, but the point is to have the clarity of the concept behind it. Hopefully people have understood now. Okay, next point. Malampatti grade 1 indicates inadequate mouth opening, difficult intubation, difficult mask ventilation, none of the above. Yes. So there are two similar questions I have set up. As I said, Malampatti हमेशा discuss करता हूँ मैं. Important है. I always discuss it out. So Dr. Sushma, Dr. Saif, Dr. Salman and Dr. Bidisha have marked answers. Other people? Dr. Yin and Yang. सही है यार, सही नाम है. डॉक्टर सेल्वी का देखो नाम पूछा, डॉक्टर यिन का नाम पूछना पड़ेगा. व्हाट इज द नेम ऑफ डॉक्टर यिन? Yin and Yang. सही नाम है. I don't know from where you people get all this, no? मतलब amazing. So someone wants to say, I am Dr. Yin. I am Dr. Yang. Anyways, all of you are right, huh? None of you are wrong. The point is coming back to studies. Okay, rather than talking about the names. Okay, anyone can keep. I'm going to keep next time. My name is Jon Snow. No, not George Jon Snow. GOT wala Jon Snow. Class by Dr. Jon Snow. Okay. We'll also try to keep names like that. You'll have a YouTube session. A YouTube session scheduled by Dr. Jon Snow. No, doctor नहीं चलेगा. खाली Jon Snow लिखेंगे यार. Doctor से खराब हो जाएगा. Jon Snow. Next name for me. All of you are correct here. The correct answer is none of the above. When you speak of Malampatti grade 1, I'll discuss with you what it is. It's neither inadequate mouth opening nor any of them. Which brings me to the next question. This image indicates what? Dr. Rajat says John Wick. हाँ यार वो भी ठीक है. What is this? Next question. Based on the same thing. Okay. अरे आंसर जल्दी जल्दी. Dr. Ankita has written something. Dr. Selvi, good. Dr. Saif, Dr. Rajat, Dr. Geen. So all of you are nice. Good. So your Malam Patti is absolutely correct. This indicates difficult intubation. Do you see? The same question can be twisted in so many formats. You just have to change one thing and the question changes. Small differences here and there and you can make multiple questions. You are absolutely right. This indicates Malam Patti grade 4 and Malam Patti grade 4 ideally is difficult intubation. It is not Malam Patti grade 1. So it's not easy. It is difficult intubation. Okay? It's Malam Patti 4. So this is what is called Malam Patti classification. This was the question this year. This question has been asked this way itself. Not the same diagram, a similar sort of a diagram as to what does this say in FMGE, and it meant what is this kind of classification. This is what is called Malam Patti classification. All right. So Malam Patti classification, guys, is based on just uvula. देखो यार, if you can see nothing, just the hard palate, it is Malam Patti grade 4. With the hard palate, you see the soft palate and just the base of uvula. It becomes class 3. Now you add a little bit more onto it. With the hard palate, soft palate, just the tip of uvula is not visible. But now you can see the fosses, the tonsillar pillars, it becomes 2. When you can see everything with the uvula clearly, it becomes Malam Patti class 1. Okay? So the point is just to identify the number of structures visible. When there are no structures visible, remember it's 4. When complete structures are visible, it is 1. You just divide them slowly, where just some structures get disappeared, it becomes 2, and when sort of in between the 3 becomes class 3. Okay, so 1, 2, 3, and 4 is how you identify in the exam. All right. So only you can just see the hard palate and the number of structures getting added onto it slowly, or the other way around. You can go from the uvula also. Okay, so you can either progress like this to remember in exam or like this, both the ways. So that's how you identify. Why is this important? They say. And why was this Malam Patti done always? Like imagine a patient comes into the OT and I tell the patient, oh, I just open your mouth. I want to see it once. Is it possible? I mean, imagine you're sitting inside the OPD, PSC chamber. Patient comes for a surgery. You have to tell the patient, oh, open your mouth. I want to see once. Patient will बोलेगा पागल हो गया क्या doctor? Okay. He'll say, मेरे को देना है spinal anesthesia. For example, a patient is coming for hydrocele surgery. It has happened with me before as I'm discussing. Patient has come for hydrocele surgery and we say मुंह खोलो. तो उसे बोला सर सर्जरी तो नीचे का होना है, आप मेरा मुंह क्यों खुलवा रहे हो? You got my point? So this actually happened with me. You go sit in a government hospital. Patient is coming for hydrocele surgery, hernia surgery, and you tell the patient मुंह खोलो. मेरे को तुम्हारा मुंह देखना है. तो सर से मुंह से थोड़ी निकालने वाले हो. Okay. This point is hydrocele is not going to come out from the mouth. Alright, so why opening my mouth and seeing? That is the problem. Imagine a patient is sitting in front of you. How to control your laughter? Okay? You are sitting in your OPD. Patient comes to you with hydrocele. And patient is telling you, sir, operation to niche ka hai. It's to happen below. Will you take it out from my mouth? I said, no, yeah. I'm not going to take it out from your mouth. I'm seeing it for some other thing. Alright? So all this happens. Alright? When you have patients coming for orthopedic procedures of the lower limb, they are like, sir, पैर का surgery होना है, मुंह का नहीं. It's a common thing which all anesthesia people face. The point is, we see it because this helps us to predict difficult intubation. They say that Malam Patti is a kind of reflection of the glottic opening that you see. So when you put a laryngoscope, alright, so when you say of Malam Patti 1 and 2, where all the structures are visible, you expect the vocal cords to be visible. In fact, this is called Cormack-Lehan grading, which you must have seen in ENT, alright, where vocal cords are visible and absent. Even this has been an MCQ question. So in Malam Patti 1 and 2, you get Cormack-Lehan 1 and 2, where vocal cords are visible. Malam Patti 3 and 4, like just by the mouth opening, where you don't see any structure, you expect that in patient, when I put a laryngoscope, I'll not be able to see the vocal cords. This is the correlation between them. So therefore, Malam Patti 1 and 2, I expect that vocal cords will be seen in the patient. Malam Patti 3 and 4, I expect vocal cords will be not seen in the patient. So therefore, Malam Patti 1 and 2 relatively turn out to be easy airway because vocal cords ideally would be seen. Malam Patti 3 and 4 become difficult airway because vocal cords will, I expect them not to be seen in the patient. Thumbs up, is that okay? So basically Malam Patti का मतलब होता है open the mouth, extend the tongue, do not phonate, and you look at the posterior pharyngeal structures. This is Malam Patti. Okay. Thumbs up everyone. Point clear. Malam Patti. Are everyone okay? or you're still thinking about taking out hydrocele from the mouth. Okay, so that is Malam Patti classification. Let's go to the next question. Okay, so which of the following produces maximum greenhouse effect? Ether, enfluorine, halothane, nitrous oxide. I'm drinking water, still it is cold. Again I'm feeling cold, then I'm drinking water. क्या करने का? Okay, I answer. Maximum greenhouse effect is seen with which of the following? Dr. Ankita has given an answer. Other people? अरे क्वेश्चन मार्क नहीं होता है एग्जाम में डॉक्टर हीन, ऐसा क्वेश्चन मार्क नहीं आता है. ABCD. It's a common question now, and we need to know it because people have become environmental conscious. Na, environmental consciousness level. People from Sweden will send a message to your house. Greenhouse effect, greenhouse effect, greenhouse effect. You people know that, na? And we doctors are contributing to it, especially anesthesia department. We are contributing a lot to that greenhouse effect. Okay, so most of you except Dr. Rajat has given the correct answer. Absolutely, Dr. Rajat, you are right. Huh? Dr. Rajat, correct answer is D, nitrous oxide. Okay, now the point is all the inhalationals have greenhouse effect. In fact, all of them. The maximum greenhouse effect is seen with two of them right now. One is nitrous oxide, other is desflurane. Remember this. In fact, nitrous oxide is more than desflurane also. Remember this point for exam purposes. Okay, so nitrous oxide is more than desflurane. Now, what is basically doing? What is it doing? What is nitrous oxide doing? So nitrous oxide, guys, it kind of decreases the ozone layer. This is the ozone layer. All of you know this. So what nitrous oxide does is, when you give nitrous oxide, it decreases the ozone layer. Okay, so therefore, because the ozone flow, the same thing is getting decreased by other things also, but all those carbon dioxide, all those things are decreasing the ozone layer, all of them. All this is causing environmental pollution. So nitrous is a gas that is decreasing the ozone layer, and because of this, it is causing environmental pollution. And that is why nitrous is called as a greenhouse gas. It is contributing to it. Now the point is, nitrous oxide is a gas which has been used right from 1773 onwards. Initially it was not very successful, but for anesthesia it is just used as for analgesia. Basically the use of nitrous is as a carrier agent, right? So that is why people want to throw nitrous oxide out, because it is being used from that time. Today is 2021, we still use nitrous oxide for the reason because it works as a carrier agent. Alright, so we have to throw it away. The new drug has come which people are trying to replace it with. So nitrous oxide gets replaced by which one? Which is the drug that is going to replace nitrous oxide, on which research is being done? Which will replace? Which one to replace nitrous oxide? Because nitrous oxide has got the maximum greenhouse effect. So people are doing research on one inhalational agent to replace nitrous for a carrier agent. Okay, let me ask you the options now in terms of A, B, C, D. A, B, C and D. Let me give you four options. Helium, heliox, xenon या एंटोनॉक्स. यस गाइस, A, B, C, D. क्वेश्चंस ऐसे बनते हैं, ऐसे क्वेश्चन आता है अपने को. जैसे किसी को ये आता है, किसी को ये आता है, अपने को क्वेश्चन आता है. क्वेश्चन ऐसे ही आता है. दैट्स हाउ क्वेश्चन कम्स. Yes, so I think people have started marking. So I can see fewer responses in front of me. Dr. Salman, Dr. Vidisha, Dr. Selvi, Dr. Rajat, Dr. Salman ने दो आंसर दिया. Dr. Salman, one answer. So which one to replace nitrous oxide then? Which one? Dr. Ankita, Dr. Rajat, Dr. Vidisha, and initially Dr. Salman. You are also correct. Xenon is the correct answer. That's exactly why people are doing research on xenon. Helium is a gas which works as a carrier of oxygen. That's why you have this heliox here. Correct. Entonox नहीं. Dr. Salman, Xenon is the correct answer. ये देखो, that is how you people do in exam also. Okay. So all of things you think ना कहीं सुना है, we have heard it somewhere, then you don't mark it correctly in the exam. So the correct answer, guys, remember, is xenon. Xenon is the agent that they are thinking to replace nitrous oxide with. Okay. The reason that xenon is not used because it is expensive in nature. Okay. Xenon is expensive. That's why we are not using it. Otherwise, you would have used it. It is expensive, bronchospasm, and there is no anesthesia machine from where you can give it. Okay. There is no anesthesia machine. It is expensive and no anesthesia machine that you can use it for. Otherwise, the drug that will replace nitrous oxide is xenon. In fact, xenon is said to be the most ideal anesthetic agent. Most ideal. Thumbs up, everyone. Is it clear? Entonox, if you know, is a combination of nitrous and oxygen. So therefore, it's going to cause greenhouse effect. Na? Same thing. And if you find helium and heliox, guys, helium and heliox works as just as a carrier of oxygen. Okay? So the correct answer is xenon. Carrier of inhalational agents would be xenon. Thumbs up, everyone. Okay, Dr. Rajat gives a thumbs up. Correct? So this was a simple question, but that's how questions can come in the exam. Alright, so nitrous oxide is the answer here, and the drug, the inhalation that will replace it ideally would be xenon. Okay? That's why xenon is important. Okay, so which one of the following is best used for the procedure being done? From the ones that are given to you. Dr. Sibing John says you are from class 11. Arey, but then this is a class, this is for PG entrance, na? You would not know, Dr. Sibing John. Once you finish your 12th and you join, then you come again. Dr. Sibing John. But good to see. How will you understand all this? This is basically medical right now. But good, if someone from 11th standard is also attending, that's nice. Good to see. Dr. Sibin John, 11th standard, attending anesthesia. ये तो पूरा बेहोशी का ब्रांच है, Dr. Sibin John. It's behoshi. Put someone to sleep. Now, I think all of you have given me the correct answer. Mystic Arun. ये देखो एक और मस्त नाम है. Really nice. I love that name. Mystic Arun. Mysterious. Right. So all of you have given me the correct answer, including Mystic Arun, Dr. Mystic Arun. Imagine Dr. Mystic Arun को एग्जाम में सब लोग बोलेंगे, Dr. Mystic Arun, please give your answer. Okay, all of you have given correct answer. Thiopentone, absolutely correct. Okay, ideally, which of the following is the drug of choice for the procedure being done? Okay, so let's change the options a little bit now. Huh? Let's change it. Let's make a new question here. Okay. Which is the drug of choice for this? So let's cancel out halothane. Let's cancel out these agents now. Okay, let us put this way. Since thiopentone is there, I'll give you 4 options now. Thiopentone. Okay, we have propofol. We have methohexitol. And let's put one etomidate also. So which is our drug of choice, guys? Now. हाँ लिख दिया ना 4 options. Thiopentone, propofol, methohexitol. Okay, so we make it A, B, C and D. ये अपना 11th वाला बच्चा है अभी. वो कहाँ गया सिबिन जॉन? Is he there? He's gone. 11th का बच्चा, उसको ही पूछ लेते हैं ना. These are drugs. Right. So I think most of you have given me the correct answer. So ideally, the drug of choice for the procedure being done, drug of choice is methohexitol. So now, why is methohexitol the drug of choice? Okay, so normally people would say methohexitol is a drug of choice. Okay, correct. All of you are correct. Okay, I get your answers. So methohexitol, guys, is a drug which is a pro-convulsant drug. Pro-convulsant का मतलब होता है it actually causes seizures in the patient. अरे तो अगर सीजर कॉज करता है तो इसके लिए क्यों यूज करते हैं? बिकॉज द प्रोसीजर बीइंग डन इज ECT. व्हाट इज फुल फॉर्म ऑफ ECT? फुल फॉर्म ऑफ ECT इज इलेक्ट्रो convulsive therapy. Correct. You want convulsions to take place in the patient. So methohexitol, electroconvulsive therapy, convulsion होना चाहिए ना patient के अंदर. So methohexitol, being a pro-convulsant drug causing seizures, becomes the drug of choice for electroconvulsive therapy. Okay, ECT in psychiatry. Am I right? It is kind of helping it, synergistic action. Problem, methoxytol as a drug, methoxytol causes hypothalamus, pituitary, adrenal axis suppression. Okay, it causes hypothalamus, pituitary, adrenal axis suppression. HPA axis suppression का मतलब होता है पूरा कैटेकोलामाइंस भी गया, ठीक है, स्टेरॉइड्स भी गया, that whole axis is gone. It is getting suppressed, because of which methoxytol is not used anymore. It's not even available. I mean, I don't know. I've never seen it, nor I've used it. It's not available. और मैं तो बुड्ढा हूँ, ठीक है. So methoxytol is not used anymore. That is why people don't use methoxytol. What they use nowadays for ECT is basically thiopentone or propofol. Remember, both can be used. Thiopentone or propofol. And followed by this, you need to give muscle relaxation, as Dr. Salman says, and that is done with succinylcholine. So nowadays it's not methoxytol which is used, but what is followed now is either thiopentone, propofol, and then followed by succinylcholine, which you give it to the patient. It's not like how they show you in movies, huh? There's one hero like this and 10 people are holding like them, and someone comes and the doctor comes and gives a shock this way. Shock nowadays, ECT is given only after anesthesia, not how they show in movies. You know, where the patient is awake, shouting, howling, and someone comes and gives a shock to them. It's wrong what they show in movies. They're degrading us, which is wrong. Some movies are helping us, huh? Like Marcel. In South India, there's a movie called Marcel. Vijay is a hero. He's a big hero down south. Though he has gone and done cricothyroidotomy. So you see that movie, all of them are aware. That is something good. You know, it kind of elevates what is being done. Alright. So other movies which show them ECT being done without anesthesia, that is wrong here. You never do like that. It's not that it's sort of, you know, given like that to a patient. You always give anesthesia before giving ECT. So it's always thiopentone or propofol, which is used nowadays, followed by succinylcholine, and methoxytol not used anymore. Alright. Now speaking about these drugs, do you realize enflurane actually can cause seizure in the patient? Do you know? Etomidate itself can cause focal seizures in the patient. Though they can cause seizures, guys, these are not the drugs which are used. You might have said methoxytol is a drug which causes seizures and is used, but enflurane is not used anywhere nowadays. It's inhalation agent anyways. Inhalationals are not used for that. Similarly, halothane is not used. For the CNS or brain, neuro, nothing is used with that. Okay, etomidate itself can cause seizures. Myoclonus, it is not used. It's a side effect of etomidate, which I think I discussed previously when I was taking this YouTube session. Thiopentone becomes a drug which is commonly used. Clear, everyone? Okay, thiopentone. Okay, let's identify. A, so Dr. Sirin, a lot of people have the answers. I can see all confusion between two things, which is A and C. But Dr. Salman takes his time as usual. Dr. Salman has thought over it properly before he marked the answer both. Dr. Saif, Dr. Salman, Doc Beatles. ये देखो एक और मस्त नाम आया, Doc Beatles. Beatles ही है ना? Battles. Sorry, Doc Battles. I thought Beatles यार. I'm more of a guitar player ना, तो मेरे को गिटार में मेरे को Beatles सुनाई दिया. Okay. So Milky's propofol is everyone saying, but there are few people who mark the answer both. The correct answer is both. That's exactly why question is there. Yes, it is milky white what you see. Absolutely correct. This is milky white, but our brain is tuned to think that whatever goes milky white from the medical profession or, you know, from anesthesia to a patient is basically propofol. Propofol, because we know it so much. What we don't know, that it's not just propofol. Can you see this is etomidate, which is also white in color? Can you see this? It's not just propofol, even etomidate, which is white in color. Do not get confused. Dr. Bhargav says white color substance is propofol. Haan, Dr. Bhargav, not just propofol, it is etomidate as well. That's exactly why I'm showing you. Okay, all of you, is it clear? So therefore, please read what it is there. This is what many times we are not aware. Can you see this is white in color? Can you see etomidate? It comes white in color. I'm not saying there is one thing which comes without white color also. But if an option like this is given in exam, remember I'm showing you something which is available in the market. I'm not even showing something from outside, right? Or something under research. I'm just showing you what is available in the market from, things which are there. So therefore you have propofol also white in color as well as etomidate. Both of them are emulsions. Can you see it's an emulsion? Propofol is an emulsion as well as etomidate is an emulsion. Okay, so both are emulsions, both are white in color. So remember there are few properties which are similar to both of them. That is when you speak of propofol and etomidate, Dr. Bhargav says another also present, please do update. Another for what? White in color पूछ रहे हो Dr. Bhargav, what are you asking about Dr. Bhargav? Sitiraju, I'm trying to see the, ask your question directly ना, मेरे को समझ भी नहीं, I didn't understand your question. Otherwise, Dr. Bhargav. So another का मतलब है कि etomidate is available in two forms. One is a clear, clear vial, and other thing which comes in the white form. Okay, white is what is normally available as emulsion. Okay, so this is an emulsion which you get. Similarly, propofol, which is white in color, it is also an emulsion. In fact, another thing common between both of them are that, yes, Dr. Warrior, yes, there is something which is white in color. You must have seen total parenteral nutrition, TPN going to a patient. You must have seen that TPN. In that TPN, you get that white colored fluid which goes absolutely white in color. That is the intralipid. You must have heard of something called as intralipid, which is used as a treatment of bupivacaine toxicity. MCQ question. Yes, Dr. Warrior, bata to raha hu. That TPN, the total parenteral nutrition, which goes in an ICU to a patient, you get a bag which is white in color. It's white in color. It contains intralipid, it contains lipids, that is white in color. This is used for treatment of bupivacaine toxicity, the same thing, and that is also used for total parenteral nutrition, and that is white in color again. ये कौन आ गया यार? यादिस, ये question is wrong. Dr. Yadis, कैसे रो? नहीं, ये अपना वाला नहीं है. Someone from outside. In the sense not medical type. Sorry. I don't whatever is typed. I don't know. बाकी लोगों को समझ में आ गया? Dr. Bhargav. TPN, that's what I'm saying, na, TPN. So TPN also comes white in color, but anyways, it depends as to what options are given in the exam. Remember, ideally, from anesthesia point of view, you will have. Dr. Bhargav says interesting question. Thank you, Dr. Bhargav. अरे अपना सब क्वेश्चन ऐसा ही होता है, तभी तो मैं बोलता हूँ यार, please download the app and go for the special classes which are free. The reason is that हम लोग ने इतना MCQ करके store करके रखा है. Forget that also. On YouTube also you will find so many sessions of mine which are recorded and kept. Not me, all of us. So when you're sitting in the washroom and you're seeing Netflix, उससे अच्छा थोड़ा सा MCQs देख लो ना. All of you know na, nowadays people don't go to washroom without a mobile. It's an urgent thing. I mean, that washroom is not urgent. Mobile is urgent in the washroom. Do you know that? So you'll finish off your movies there, you'll finish off everything there. People want to take a break when you're studying for like 15-20 minutes and want to take I'll go to the washroom. So people used to go washroom initially for something else. Now they take the mobile in the washroom. Okay, तो उतने में देखे कोई MCQ देख लो, कोई सेशन देख लो. I said all those things are recorded either on YouTube or the special classes that we have on Unacademy. It's a similar way. We make those MCQs so that you people, it can reach to all of you. Na? What's the my point in making those MCQs or trying to make it like this if you people are not going through it, right? So hopefully all that can help you increase your knowledge, appear in the exam and score well, which is what we want. And I showed you before also. Our whole aim, in fact, मेरा whole aim होता है when you people are sending me those messages. I love that. That is the reason I teach. I just teach because I love to get these messages. As I said, this was the message. ये मेरे को कल ही आया सब messages. All the people who have given their, FMG exams. All the students who have my Telegram ID. As I said, this is exactly why I teach. कहाँ गया यार? This is exactly why I teach. This is the reason. First attempt में all these people have cleared. Okay, FMG. Alright, this is why we teach, guys. This is exactly what makes us to come back to teaching again and again. Alright. In my hospital, I'm the head of the department. So I teach because of this reason. I like it. Okay, so that's my Telegram ID, guys. You can write it down. Oh, I'm not finished with the session yet. I'm just telling you that's my Telegram ID. Any questions and doubts you can ask me. Let me go forward. Wherever we are. इस पे थे. We were at this question. Okay, so we have kind of finished about the etomidate and propofol. So remember, both of them are white in color because both of them are emulsions, ideally. emulsions and white in color. So you will find both of them to be white in color, both. Okay, so let's go and see another question. Rocuronium is known to cause good. It was a good interactive session. I liked it. All of you answered very well. That's how I like. YouTube में प्रॉब्लम क्या होता है पता है, इधर और इधर दोनों देखना पड़ता है. I'm seeing the laptop and I'm seeing this as well. D किसने मार्क किया? How could you mark D? All of you. Thyroid dysfunction. Let me see. Till now, I get only one person who's marked the correct answer. Just one. And that's Dr. Sushma. Okay. Non-depolarizing. Rocuronium. Okay. Non-depolarizing. So I was discussing with you non-depolarizing drugs and I told you their classification. They are long-acting. They are intermediate acting. They are short-acting. And they are ultra-short-acting. Guys, the correct answer here is B. Rocuronium is known to cause pain on injection. This. It does not cause histamine release. It does. Thyroid dysfunction time pass में लिखा था यार. ये भी all of the above भी time pass में लिखा था. So that's why guys, remember, if you don't know the points, we normally tend to make a mistake. So read those points clearly. When you speak of non-depolarizing drugs, remember long-acting में you have drugs like pancuronium. इसका problem होता है increase in heart rate, increase in BP and arrhythmias. Okay. Intermediate में you have got vecuronium. I discussed with you. It maintains the cardiac output. It's the most cardiac stable drug. Here intermediate acting you get rocuronium. It is the fastest acting, it increases the heart rate, and more importantly, it is painful. This is the only one which is painful out of all the muscle relaxants, both depolarizing and non-depolarizing. It is the only one which is painful, hence this comes as a question. Okay, rocuronium is the only one which is painful. That's why this is asked as a question. Okay. In short acting, then you get rapacuronium. Again, that causes a lot of histamine release for which it is not used. Right. Histamine release, guys, is seen with the other group of drugs commonly, which are, benzyl isoquinolinum compounds. Like you will see it with doxycurium. You will see it with atracurium. You see that with mivacurium. You see it with succinylcholine, slight histamine release, and rapacuronium. These are the 5 drugs which cause histamine release. Okay. In fact, succinylcholine has histamine release, but no bronchospasm. Apart from that, doxycurium, atracurium, mivacurium, rapacuronium, all these cause lot of histamine release. ठीक है? Thyroid dysfunction किसी में नहीं होता है. None of these muscle relaxants. If you have to speak for thyroid, the place where thyroid from anesthesia point of view is important is thiopentone. Remember, T for thiopentone, T for thyroid. So this is where it's not used. Thiopentone, not muscle relaxants also. Remember, drugs are confusing topics. They are all, it's just like pharmac when you find them confusing. You need to remember individual properties, only then you can mark them correctly in the exam. Okay? So you need to work upon the properties of individual drugs. I think all of you, your concepts have been very good regarding everything. In the sense that when we were discussing about LMA, we were discussing about intubation, we were discussing about malam patti, we discussed about monitors, right now, neuromuscular monitor, we discussed about the bispectral index. You were absolutely okay with these properties. Where what I found in the 2-hour session that I've taken is that drugs is where all of you need to be concentrating on. Drugs means the individual properties of those drugs. When I'm speaking of thiopentone, I'm speaking of etomidate, I'm speaking of propofol or ketamine. So you need to know these drugs. This is where I found a little bit of, difference from the answers that you people gave. Otherwise, you were wonderful in answering about, LMA, intubation, malam patti, various monitors that I was speaking about, the different topics from anesthesia. Thumbs up everyone, is that okay? So here the rocuronium is known to cause histamine release. That is the correct answer. Okay, pain on injection. Histamine release, I told you, are the 5 other drugs. Even I can make mistakes here. I'm allowed to. Rocuronium is known to cause pain on injection. थोड़ा सा फर्क पड़ जाता है when you're on this side, when you're on the other side of the table ना, you're always थोड़ा सा scared. When you become on this side of the table, then you feel अरे चलता है, sort of. Okay, so pain on injection is the answer. Let's take another question. Identify. So let's see the answers. It's the same Dr. Naveen. Too good to see you again. Okay, so let me give the answer. I think most of you have marked it 1, 2, 3, 4, 5, 6. I think all of you, except one or two here and there. So all of you mostly have given the correct answer. It is D. It's the correct answer. This is what is called as a Tuhi needle that is used for epidural. It is not a spinal needle. Okay, LP needle is a lumbar puncture needle that is used for spinal anesthesia. So spinal anesthesia needle does not have this 1 centimeter marking that you see. Now, the point is this is a Tuhi needle for epidural, correct? For epidural because it has got this 1 centimeter marking so that you know how far you are from the skin. This needle has 1 centimeter markings. It is thick. It has a tip which is curved, which is called as a Huber tip. It is thick so that you can pass a catheter from within and this catheter can be left inside the epidural space. That is the reason. Okay, in fact, when you find a spinal needle, you will find the spinal needle looks like this. It has a bevel like this. Okay, so this was the cutting QB spinal needle. This used to cause more damage to the dura. Hence, people started making those pencil tip spinal needles, which are like this. Can you see? So when this needle punches the dura, this is what causes PDPH. When this needle punches the dura, I am talking of spinal needles now. Okay, this is called Whittaker needle. Okay, this is called the pencil tip needle, non-cutting needle. This is what is preferred nowadays to decrease the chances of PDPH. Okay, QB causes more chances of PDPH. So this is the LP needle, which is QB is the name, Quincke Babcock, or Whittaker, which is the pencil tip. So QB is the cutting one. These are LP needles. Okay, Tuhi needle is for epidural. So this needle has a tip which normally goes like this. Okay, so you will find at the end the tip is slightly curved so that you don't cause much damage, and it is like this, and it is thick. This tip is called a Huber tip, and so that you can put a catheter from here and insert in the epidural space. It is slightly curved that you see. This is what is called as a Tuhi needle, and they have got these 1 centimeter markings. It has got this 1 centimeter markings which is not seen in the spinal needle. Okay, so Tuhi needle helps you to identify, or it is used for the epidural, as an epidural needle to find the epidural space. Okay everyone, Dr. Vicky Kumar says A. Nahin, Dr. Vicky Kumar, that's what I was discussing. Ye Tuhi needle hai used for epidural. So you want to find for an epidural, I'm going to use it. Okay, clear everyone? So let's take the last question for today, and then we'll end the session. Hopefully you've understood. Thumbs up everyone. Thumbs up all of you. Okay. Are all okay? Then we'll go forward. If there's any doubt, you can ask me. I think okay, Dr. Saif says that. Okay, Dr. Salman, Dr. Saif. Okay, let's take the last question for today then. Okay, and I'll try more YouTube sessions in the next year. Happy New Year to all of you before we end. Okay, and hopefully you get the seats of your choice. Kindly identify. What is this? Is it intravenous cannula, dialysis line, central line, arterial line? So I'm getting few answers. Right. So remember, I think most of you again have given the correct answer. Most of you, right? And the correct answer is yes, D. It is an arterial line. Can you see? There is blood flowing black into it. And forget everything else. Can you see it is written arterial? Many times when you get images in exam, whenever, please look at the image. So it's told so many times, half of the things might be written in the image itself. So many things are there. Okay, it's written arterial. Okay, more than that, this is not an IV cannula. Intravenous cannula, guys, remember, is what has going into the vein. So intravenous cannula normally goes inside the vein, IV cannula. Arterial line is put in artery. So you're going to use two types of an artery. Normally we use the ulnar radial artery, which is the most common used, or you can use the ulnar artery. Whenever you're using either of them, you know there is something called as a Allen's test. You're always supposed to do Allen's test to check the collateral, you know, the patency of the collateral supply. So remember, whenever you put an arterial line, the most common place used is the radial artery. Ulnar artery again can be used, but you have to always do Allen's test, which you must have studied in surgery before you put an arterial line. IV cannula goes in the vein. Central line also goes in the vein. So when you speak of a central line, so central line again goes inside the vein. So this is a central line. Can you see this? Central line. But central line is inserted in a major vein. So it has to be an internal jugular vein, as you can see over here. It can be the subclavian vein, which is here. It can be in the basilic or the cephalic. But in the small veins, you can't put a central line. Central line has to go from the, you know, it has to go from the major vein. It comes to the tip of the superior vena cava and the right atrium. ये यहाँ पे आके central line आ जाता है. The tip lies over here. Okay, so this is what becomes a central line. When you insert it over here, it is an arterial line. This is used for continuous measurement of blood pressure. Continuous, so you get every beat you get to see the blood pressure, every beat. This is used in those major surgeries, transplant surgery, ICU patients, critically ill patients. This is where we put arterial line, major surgeries which are done, major plastic surgery and all, where you want to see beat to beat blood pressure measurement. So the correct answer here is this is what is called as an arterial line. Okay, dialysis line again goes from the femoral side and you get a dialysis done of patients from there. Okay, so it goes from the femoral end. Okay, that is a dialysis line. Dialysis again is sort of a central line only, but it goes inside the vein. So as you can see, all the things that we have mentioned here, intravenous cannula is in a vein, which can be in a small vein also. Dialysis line also lies in a vein. Central line goes in a vein. Arterial line goes in an artery. Because artery has continuous flow, that's why you get to see some blood also here coming back. Of course, you see that in a vein also, but in arterial, the flow will be much more. If you have to give some pressure from here, otherwise arterial blood will come back here, like this. So you have to give pressure from here so that it doesn't come out. You have to attach a pressure bag always. Right, it is invasive blood pressure measurement is what Dr. Salman says. So arterial line, let me put it this way, absolutely correct. It is invasive blood pressure measurement. Routinely, whenever we measure blood pressure, it's always called NIBP, non-invasive. This is what is called as invasive blood pressure measurement, which gives you beat to beat blood pressure. Clear everyone? Hopefully you've understood these points, and thank you for joining me this session. I took 2 hours, even I enjoyed it. Today's 2 hours was very nice. Okay, so Dr. Salman sat all through that. Pura 2 घंटा बैठे YouTube पे. Absolutely nice. Okay. Dr. Naveen says, does red color signify any size? No, Dr. Naveen, not by sizes. Nothing to do with size over here. Okay. Dr. Rajat, thank you everyone for joining me at this session. If there are any questions or doubts, let me share my ID with you. So that's my Telegram ID. If there are any questions and doubts, you can ask me directly. Okay, and thank you for joining. It was wonderful. I liked it too. Okay, so when it's interactive, even I like it. Na? So that's what happens on the app. When you have the app, so there are so many people over there that it becomes much more interactive. Okay, thank you, Dr. Sushma, Dr. Mystic Arun, nice name, Dr. Selvi. It's good, na? People will call you by your name then. Your name is so good. Dr. Rajat, Dr. Salman, thank you everyone. Thank you everyone for joining me. That's my Telegram ID. Any questions, any doubts, you can ask me. I don't have a Telegram group. I don't think itna anesthesia padna hai. But if there's any doubt, you can ask me at my Telegram ID. Okay? And if you clear your, whenever you get a good rank, do message me. I like it. Okay? Take care all of you. All the best. Do well. Happy New Year. Okay guys? Bye-bye. Thank you. Thank you, Dr. Vicky. All of you. Thank you so much. Okay? Till we meet again on the YouTube or on the Unacademy app. Dr. Salman says, when will be the next class? Dr. Salman, अब मेरा next class उस पे आएगा Unacademy app पे. I'm going to take an MCQ session on that. Special class, free class आएगा. Okay. That's why I say ना, you follow me up ना, guys. You download the app. As I said, download the app and just follow. Follow से क्या होता है? Whenever I put a session ना, then I can, like you guys will come to know. They have another good name, Twin Flame Media. Thank you guys. Okay. So Dr. Salman, you can do that. All of you can do that. Just download the app. Dr. Rohit says, when we give adrenaline to the patient. Arey, many times, yeah, Dr. Rohit, CPR mein. We'll give it in CPR, na, Dr. Rohit. So therefore, when you get a defibrillator, yeah, so when you've attached and seeing the rhythm, if the patient's rhythm is pulseless electrical activity and the patient's rhythm is asystole, And these are the two which are called as non-shockable rhythms. In the non-shockable rhythms, you will not give a shock, you will give adrenaline. Okay, Dr. Rohit? You'll be giving ADR. Pulseless electrical activity and asystole. Hopefully, I've answered that point. Okay? Chalo, take care then, all of you. Okay, all the best. Do well. Follow me up when you download the app. Okay, in case you have it. Otherwise, you can be there on YouTube also. I don't know YouTube session kab hoga, but Unacademy, I'm having my special class, the free class. I'll be having that MCQ discussion again, which we keep on happening here over the weeks. We keep on doing it. Just that we have to maintain with our hospital duties. So I can't tell you beforehand as to when my sessions will be there. That's why we say download the app and do follow us so that you will come to know when our next classes are held. Okay. So thank you so much, all of you. All the best and Happy New Year. Take care. Bye-bye.